Howdy, ladies and gentlemen. Thank you very much for joining me today in this live podcast on a very important and hopefully valuable subject called How to Take Herbal Medicine. I really hope this benefits people who are interested in taking herbal medicine, people who are already taking herbal medicine, and of course, my own patients who have the herbal medicine which I provided. Now, when we have new patients, we always send them like a couple pages of information on how to take the different forms of herbs that we provide. But still, we get a lot of questions and a lot of misunderstandings. So people told me maybe I should do a recording on this subject. So I just turned it into a podcast, and then I'll take the recording and use it to educate my own clients in the future. So if you're one of my clients and you're getting this recording, then please take note and be educate yourself in how to take the herbal medicine that we have. And once again, we are sponsored by Herbalist, herbalist.com. And it is my business, but they do pay the bills here for this podcast. And you can find them at herbalist.com. Most of the products I show you today will be on Herbalist, but not all, mostly only the teas. So let's start with the different types of herbal medicine. First, we talk about like homeopathy. Homeopathic medication is very mild, very gentle, and it's stimulating an immune reaction or a reaction from the antibodies, or just the small doses of the herb that is like almost the essence of the herb in homeopathy. In fact, modern vaccines are based on the knowledge of homeopathy. And now, if you're my patient, you probably wonder why I didn't give you any homeopathy. How come I didn't use it? Well, it's not very strong. And most people, they have advanced conditions: diabetes, high blood pressure, cholesterol, tumors, cancer, inflammatory bowel conditions. And really, this homeopathy is just too weak for these conditions in these advanced stages. But if you want to treat like an animal, I've had like cats and dogs that had allergies and kept sneezing. I gave them homeopathy and just put a few drops in their food every day, and it worked very nice. Babies, after nursing and before they become old enough to take teas and powders and swallow powders, homeopathy, another option. Here, I don't sell it, of course, but here's a good example. This is for your eyes, for sty in the eye. I don't make this product. It's called Sty Eye. Yeah, it's not really. There we go. Sty Eye Relief by this company, and this is using homeopathy. So again, for eye infections, sty in the eye, bloodshot eyes, anything in your eye has to be very gentle, just like the baby or the kitten. So homeopathy is perfect. Now, they work very nice for allergies as well, but I don't really use them much because most people, their condition is too advanced to even worry about homeopathy much. So that's why person only doing homeopathy is kind of limited. It's to be a good herbalist, you really have to have all forms of herbs available. Just to use homeopathy, you're going to be very limited. You're not going to be able to treat cancer, and not going to lower blood sugar or any serious, treatment to any organ. You'll see most of these herbs are not treating health issues. They're treating organs and systems in the body. And homeopathy doesn't have that cleaning, detoxing, or even rejuvenative quality that we need most of the time for a treatment to an organ or system. Now, the other form of herbal products is essential oils. Here, I do sell some essential oils. I do frankincense oil. I do myrrh. And this one here, I like. It says so we can get a focus on here. There we go. Yeah, well, rose oil, focus, baby. Is it time for a new camera? Rose, you see the word rose anyway, huh? Rose water in a spray. Well, actually, this is a spitzer. This is a mistake. Uh, this is not the spitzer. This is the essential oil. So, unfortunately, we got the wrong label on there. But you can see lowers anger, and it's a bit relaxing. It's sweet. It's cooling. I think I'll have a little myself. And we do put it in distilled water, and we use it as sprays too. That's what this label's for. And this is pure rose oil, and very nice, very sweet, very calming. And we use it for people who are a little hot and irritable. And essential oils are very nice. I think there's a lot of hype about essential oils that they're going to cure everything. People are using essential oils in many wrong ways. They're over relying on them. And to be an herbalist, you can't only use essential oils. Again, you're very limited. It's the aroma, it's the scent, which is used traditionally, and essential oils weren't used much in history. Frankincense, rose oil, there were some, but not much. Again, it's the aroma, it's the scent, it affect the nervous system to get in the respiratory. Some essential oils, like you could put in a humidifier, like eucalyptus or lemon peel, or even thyme, and this will help. You can breathe it in and help clear the mucus and congestion. So essential oils work very well in diffusers. They work very well in humidifiers, where you're going to put it in the environment. And you can change the mood in a room. So I'll put a little essential oil under a candle, and that will make a nice scent in the room, particularly frankincense, and it smells very pleasant. And people come in, it does affect their nervous system and their state of mind, but they're very refined. I see a lot of people not properly using essential oils. They're putting them in water, they're drinking them for serious health issues. And of course, the results will be minimum. And they're putting them in. I saw somebody recently, they had a child with eczema, and they were putting essential oil of eucalyptus and what was the other one, like moringa or something, and they were putting this on the baby. And these are very hot essential, these essential oils are very hot. Even though they were using a carrier oil, I really advised against it. This was inappropriate. Maybe just a little, I recommended a little lavender essential oil in some coconut oil. And that's fine. You can put a little in the bath. You can sprinkle a little in the shower, on the floor, little things like that. But you can use them to put a little on the pillow for the child, help them sleep, little mild conditions again. But really, you can't do much with essential oils. And unfortunately, they've been hyped up, over promoted, and people believe they can treat everything with essential oils. Well, that's not correct. The next is tinctures. And I think this tincture here may be more than 10. I'm sure it's more than 10 years old. It's probably like 15 years old. I have a whole bunch of them. I hardly sell them. There it is. Heart tonic tincture for circulation. This is an apple cider vinegar base, and a lot of herbs there for the cardiovascular system. And the cap on the top has become hard. It's so old. So I'm going to replace all those. None of them seem to have mold, but again, they're weak. They're very convenient. See, that's why people like these little drops and things like that. It's all convenience. So these are very convenient. Again, I use these type of tinctures for animals most of the time, and children. If I have a dog with a little inflammation or a little cardiovascular, I can put a couple drops of this in the water, and slowly it will help them. But we're dealing with an animal. It's only a few pounds, 20 pounds, or even a large dog probably need more than this. And I've had people who had tinctures and said, hey, it didn't work, and then they think all herbs don't work. Oh, I tried, lavender, passion flower, rosemary, hops, chamomile tincture, and it didn't make me sleep. And I go, how much did you use? Well, just one eyedropper, half an eyedropper. Okay, try throwing in like a couple tablespoons and then put it in the water. Even one big heaping tablespoon. Oh, then they feel it. But if you bought this for $20, the tinctures are usually more expensive and really have less bang for the money, because I can make like 20 tinctures out of one bag of tea, and the bag of tea only cost $15, $18, and I'm turning it into 20 tinctures. And these tinctures people tend to sell them even more than the tea. $20, $30, more than a bag of tea, but I can make 20 tinctures from one bag of tea. So there's not a lot of herb in there, really. That's why some people have said some tinctures didn't work, and then they think all herbs don't work. But again, if you took more, like a tablespoon, start putting in teaspoons a few times a day, then you will receive good results. But if you say you have a child, a 4 or 5 year old child, you can put a couple, an eyedropper in here to help them relax, help them to sleep, help with allergies, change the mood a little bit, mild conditions, because a child doesn't have, a lot of toxins built up in the liver, or hopefully their lymphatic system and their colon aren't all blocked up. They don't have, years of accumulating toxin. They don't have kidney damage. They don't have liver damage. So these little tinctures, just to help them get through these small little issues. So I do make a lot of tinctures, actually. I just don't sell them much, because the expectations, when you come to me and you pay money and you've already tried everything, most of my patients have always said, oh, I've tried everything. And so that usually means they were doing tinctures or essential oils or something like that. So you see, they already became discouraged because they were trying to get their blood pressure down with some tincture. This is a pretty strong tincture, but I rarely give it out because most of the people have high blood pressure and cardiovascular system are much older and much more complex, and they just need stronger formulas than just a couple eyedropper from a tincture. So again, I use them mostly in animals and young children just because they're easy to give. And if you have some tincture you don't think it's working very well, start taking 2 or 3 teaspoons of it a couple times a day, and then you will receive results. But again, no matter how much you take of a tincture, you're not taking much herb. Not much herb went behind that to make it. It's kind of a decoction of the herb suspended in the vinegar, glycerin, or alcohol. I like vinegar. Apple cider vinegars I prefer. Glycerin, not much use. I mean, alcohol rushes into the system quite well and dissolves quite good in hot water, which is a pro, but I tend not to use alcohol. I just like apple cider vinegar. I mean, I've got these apple cider vinegar ones. They've been around more than 10 years, and they're still good. And I often just give them away as gifts, as kind of complementing the whole treatment. So the next category we have is an infusion. An infusion is where you just pour hot water on the tea. And see, we got a tea here by our sponsor, Herb Tea. They make over 50 teas for every single health condition, and there's a heart tea. But if we look at the back, there's 2 sets of instructions back here. One is called decoction, and then one is called infusion. The top one is infusion, and the bottom one is decoction. So I'm going to just read the instructions for the infusion. Now, infusion is usually leaves and flowers. You don't do infusion for barks and roots. So you got dandelion root, burdock root, and seeds, milk thistle seed. These are all used for the liver, of course. A yellow dock root. So that would always be decoction. So that's why you see a professional herbalist doesn't usually mix a bunch of roots with a bunch of flowers, because the flowers can just be hot water. You shouldn't boil flowers and boiling water in a pot like, rose petals and lavender, chamomile. These are all flowers. So flowers and leaves, and a majority of herbs are leaves. There are some stems, and there's bark, but the leaves and some stems and sometimes shredded bark where it's been shredded really fine, these can be infusion. But, when you get a tea from Herb Tea, it says right on the back. So it says infusion method. Add about 1 or 2 teaspoons, more or less as needed, in a tea ball or a bag, or just put tea directly in cup. So I bought a few samples here. There's the tea ball, which, if you buy herbs on Herb Tea, they give you a little option for another $2 and you can get the tea ball. And then you have this little, people prefer sometimes this one because it's easier to open and you can just kind of leave it in the cup. I think those are like $4. And then there's tea bags. Even when you buy these teas on herbmanteas.com, it will give you a choice. You want us to put it all in tea bags for you. I don't think it's necessary. You just put the tea in the cup, you add the hot water, you cover it up for 10 minutes, you drink it. Most of the herbs will just sink to the bottom, and if you go in your mouth, the better. So you don't really need to use tea balls and tea bags. It's not necessary. I never do it. I mean, one, it's just something more to clean. And I use all the old tea. I put it in my compost, and then it goes into my little compost bin I have in the kitchen. Then it goes into my compost heap next to my garden. Then I mix it with manure and dirt and leaves and let it compost for usually up to a year. And then in spring, it becomes all dirt. And I've got all those herbs that were in there full of vitamins, nutrients, and everything all mixed in with the dirt. It's kind of all broken down by the worms and the microbes. And so then I put it right back on the garden again. So I don't really want to lose my tea in the sink or tea bags. And it just works better when it's not in a tea ball, by the way. That's the main thing. When you just put the tea in the cup and you add the hot water, all you need is one of these little hot water kettles. This one I like because it keeps it hot all day. The other one I have, it just, you flip it on and then it flips off. And then by the time you get there, you forgot, you have to flip it back on. Better to get one of these that just stays on. You could set the temperature. Just put it on a warm. Doesn't have to be real hot. Just keeps the water hot. And then you just have your cup, throw in a teaspoon. You don't need to measure it. I never measure it with a spoon. I just reach in the bag and throw in a couple teaspoons or so. If I really want it strong, like I have a tea like morning energy tea, memory and energy tea. These all have caffeine in them. And if I'm sleepy and it's early in the morning and I want to get going, I'll throw in a tablespoon. I just grab more, throw it in the cup, pour in the hot water, bring it to my desk, and let it sit for a little bit and start sipping it as soon as I can, as soon as it's not hot anymore. But if I don't need it strong, say like a brain tea or relaxing tea, I may just throw in a teaspoon or two, but there's no point to be measuring it. Take what you need, put it in the cup, pour in the hot water. And by being loose in the cup, it's going to infuse better in the water than if it's, in a little compacted tea ball like this, where it's just not going to, have as much exposure to the water. It's what you're doing is you're taking the hot water, is taking the qualities and the properties of the herb and putting them into the water, and you're drinking the water. So that's why we call it infusion, where, taking the herbs out of the leaves. That's why it needs to sit for about 10 or 15 minutes so that process can take place. That's why the water has to be hot. And that's why it works better if you don't use a tea ball or a tea bag. If you really hate those little pieces of leaves floating around there, once it's sat for 15 minutes or so, you could pour it through a strainer. And but I would just leave it in the cup, because and then sometimes there's a bunch left in the cup. You could just pour in a little more hot water and get another half a cup out of it. So I think it's the best way to take these teas in a fusion manner than in little tea bags, tea balls. It's not really necessary. Now, this infusion, though, is still much stronger than this tincture. This is why tinctures don't work well. I take one bag of this tea, and this tea is like $17.50 retail. So obviously, Hermantiz is paying a lot less than that. And from this whole bag, I can throw this whole bag in a big old pot, like a 4-gallon pot full of water, and let it cook it for simmer it really low heat, because I don't want to boil it and damage the leaves, particularly if there's flowers. I don't want to get too hot. And then I put in the apple cider vinegar. Then I let the water dissolve, and then I have my tincture. So I can make 20 bottles of this heart tincture from one bag of tea. And you're only now taking an eyedropper. So you can see you're not getting a lot of herb here. And that's why it's weak. That's why I said, if I drank the whole bottle, like if I had half in the morning and half in the evening, just dumped it in a cup. And that's what I do with some of these old tinctures, because I know they're good. And I'll just get them, and I'll have a cup of tea, and I'll just like put a tablespoon of the herb in it. Then it's starting to work. But, that gets pricey if you're buying these things for $29 a bottle, which is really too much. I don't sell tinctures, but they're usually overpriced and not very effective. Now, to get them to work, you just have to use a couple tablespoons, but this would only last you a few days. So that's expensive. Now, you could have a couple cups of a tea, 2 cups a day, and it lasts you a few weeks. And it costs less than $20. So you can see that a tea is still better. It's the amount of herbs that you're getting to do the job. I mean, and generally, the golden rule with taking herbs is if you don't get the results you want, you take more. Now, if you already start off with something weak like homeopathy, you really taking more doesn't really benefit you. But essential oils, you may have to take a lot more. You may have to. I put like whole bottles of essential oils in bathtubs, and then like a tablespoon of lavender in the bathtub, and then I'm like, oh, that's nice. Then I could really get the full aroma. But I just put a couple drops. I don't feel much, and but I put in like a tablespoon, then I feel it. And with these little tinctures, they're the same. You just have to use too much to really make it economical, unless you're a 2-pound kitten, which I do have kittens, and that's what I would give them, is just a drop or two in their food. Mix it in with a little ghee or something. That's all you need. The kittens, just a few ounces. You don't need much, because so you got to match the strength of the formula to the person. Even if I have a big guy, say I got a 280-pound guy, I may say take 2 teaspoons of it, take 3 cups a day, add a tablespoon. Then if I have a thin person who's only 100 pounds, I'm going to give them smaller doses just because of their body weight. So the bigger and the heavier a person is, the stronger and the more herbs you're going to need to have the same effect. So, you're a 280-pound guy trying to lose weight. I mean, you could just tinctures aren't going to do anything. You're just not going to feel it. It's going to just fuse between the bigger the person. There's more tissue. There's more veins. There's more arteries. There's more places for all those herbs to be absorbed into the system, and less makes it to the person's head or the organ you're trying to treat. So the next category, though, which is stronger, I'm taking herbs from the weakest to the strongest. The next category is a decoction. And here's a tea here. I don't know if you're familiar with Isaic tea, but that is traditionally used for cancer. Now, if you've read your history on it, you can see the history of Isaic tea on herbmanteas.com. When you go find this product, and it was a formula made by a nurse in Canada that was for herbs. I was not very impressed with that formula, so I made my own. And I used the word plus because I kept some of the herbs that were originally used in the formula, but I added a lot more. But you see, it's mostly roots, mostly roots and stems, and he's got dandelion root. I mean, Tulsi's a leaf, but burdock root, yellow dock root, these are turmeric root, Querceta sagrada, wormwood. These are all can be decoction. Besides, you're trying to kill cancer cells. That's the goal of this. This is not for reducing down or shrinking a tumor. This is to prevent the spread of cancer, in certain cases, or somebody who had cancer in the past and they don't want a reoccurrence. So it's going to be strong. So decoction, boiling it, makes it stronger. And you're not going to have a lot of flowers, aren't going to fight cancer cells. So you're going to have some nasty taste and bad taste and herbs in here to make it effective. So this tea really tastes bad. In fact, we sell it on eBay and we put warning, tastes bad. And we can see the feedback. People said, wow, I mean, it really does taste bad, but it does seem to, I feel it. I feel good about it. I'm ordering more. I mean, people can kind of tell that's a strong tea. And I go, what do you expect? I mean, it's meant to boost immunity and to kill cancer cells. And in fact, on eBay, I get a lot of interesting feedback from selling on eBay and Etsy, because these people aren't my patients. They're just buying one tea and they're giving me feedback. And a lot of people said that their skin got better. Their rash went away. Their hives improved. And amazingly, I got a lot of people say it was super anti-inflammatory and their joint pain got better. So, I mean, I can look at some of those herbs and I can see the anti-inflammatory qualities, but mostly I put in anti-parasitical, antiviral herbs like wormwood. I put some laxatives like Carsata sagrada. I put some blood detoxing herbs like yellow dock, burdock root. I did some immune boosting herbs like tulsi, and then I did strong anti-cancer herbs like sheep sorrel. And these are and these are all in there. And but people have given me a lot of feedback that's very anti-inflammatory. But the point is, this is decoction. So let me tell you the instructions for decoction. Decoction is you're boiling, you're cooking the herbs. You can't use a tea ball. It says put 1 heaping tablespoon. So you remember the infusion, it said use 1 or 2 teaspoons. Now we're talking a tablespoon in a pot with, it says like 3 to 4 cups of water, or, even in there. So it could be 3 or more water than you would put in your tea. So like, even 4 or 5, 6 cups of water. And then you bring the water with the tea to a boil. You reduce it to a low heat. You leave the lid off, not on, and you simmer it for 15 or 20 minutes, or even longer, until the water comes down. Technically, you should cook it till half the water is gone. So you put in like 8 cups and you cook it slowly and you bring it down to 4 cups. But it's a little complicated for people. So I just said, simmer it for about 15 minutes and then you can strain it. Or you can make it at night, bring it to a boil, turn it off, let it sit all night. By sitting all night, it will also make it stronger, because, you're trying to kill cancer cells here. You want this as strong as possible. You're not going to kill cancer cells with an essential oil or a tincture. It's just not going to happen. You're not going to even get your bowels moving. You're not going to be able to clean your liver. You're not going to be able to improve your kidney function. You're just too limited. But here we've got a pretty powerful formula in a tea form. And of course, Chinese medicine, you're going to get teas, they're going to put the mushrooms and everything in a big bag, and you're going to throw it in a pot. You're going to boil it down halfway, and you're going to strain it. And you're going to drink it 3 or 4 times a day. So most Chinese medicine is taken in decoction form. Nobody is really using tinctures and essential oil. These are just kind of modern conveniences. That's why people do it. Tinctures, essential oils, and capsules are just convenience. But this is not traditional. I only covered it to cover the subject. Now, the more stronger form of the herbs, which is the way Ayurveda does most of the herbs, and I think one reason why Ayurveda can treat more health conditions than any healthcare system on the planet, not only it's more sophisticated, it's more detailed, their diagnostics, training is more advanced than anything else. The dietary guidelines are more individualized than everybody else. But another reason is they're using churnas or powders. So here we got heart formula. It says heart tonic. We have a few different ones for different types of blood pressure. I mean, this is VP. So VP means vata pitta. So that means there's anxiety, nervousness, and inflammation. We have, there's many causes of high blood pressure. So we have another one with K. K means kapha. That means there's blockages in the artery. It's a very different formula because there's different causes of high blood pressure. So this is one. So you can't just say, okay, one thing is going to treat my blood pressure. I can have a couple, a husband and a wife. They both have blood pressure, and I give them different herbs because maybe the wife, her blood pressure is high because of anxiety and nervousness. Maybe the husband's blood pressure is high because of inflammation. Maybe the uncle's blood pressure is high due to cardiovascular blockages and high cholesterol. So this is completely different causes of your blood pressure. So you're going to get different herbs. So we covered that in the last podcast, misconceptions about taking herbs. And that is one of the biggest misconceptions. So what do I take for my high blood pressure? Of course, I get these questions all the time. And I said, well, how do I know? I don't know what's causing your blood pressure. I have to diagnose it. Once I diagnose and what's causing it, you could be causing it with your coffee, your chili peppers, coffee, chocolate, chili peppers, stress, anxiety, anger. All these things increase your blood pressure. So these all have to be identified and removed. That's what the first treatment should always be. Identify and remove the cause. Don't just take the herb. Remove the cause. Don't be a diabetic and keep having the soda pop that made you a diabetic. Don't keep taking the caffeine while you're taking sleeping meds. I mean, that's one reason you're probably not sleeping, because you're drinking all this caffeine, coffee. So you always have to remove the cause. And people don't do that. Then they think, oh, herbs don't work. Like I said, I hear it every day. I tried everything, and I've never had any client I couldn't get to sleep. And the ones that said they tried a bunch of herbs probably were tinctures, first problem. Then maybe they did a capsule, maybe just one capsule. And then maybe they were drinking coffee the whole time. So of course they're not going to get results. The cause, the coffee, the stress remained, and they just didn't take enough herbs. So you get rid of the cause, the coffee, the chocolate, stimulants, maybe even the news, anything stressing these people out needs to stop. And then you start giving them powdered herbs. When you take powdered herb, you're ingesting the whole herb. Now, the way you take them is you have a small cup. They're not teas. See, a lot of people, they refer to them as my tea. I said, no, they're not teas. We call them churnas, but we call them, we can call them powders, powdered herbs. So you just get a spoonful, put it in your little cup, and pour in a little hot water, stir it up, let it cool, or let it become at least warm, and you shoot it down like a tequila. Now, you're taking a lot of herb. Powdered herb, you're taking a lot more herb than you would a cup of tea or decoction. In fact, by weight, this is like 4 or 5 ounces of tea, powdered herbs here. And these teas, look, they're just like 3 ounces, 2 ounce, 3 ounce. So you get it a lot more in a jar. I mean, the price is a little higher, but you get a lot more bang for your buck when you do the powders. And people with serious health conditions, they realize it. Like sometimes I'll give out the heart tea, and I'll take it, say 2 teaspoons in the morning, 2 teaspoons in the evening. And then I'll just throw in the heart tea because, it doesn't taste bad. And they're drinking the tea. I said, just have a couple cups of the tea during the day. But the people will come back and say, hey, I took that heart formula. Man, my blood pressure came down over 20 points. And then I took it at night. I had to just take 1 teaspoon. It was, bringing my blood pressure down too much. And some people even say I didn't notice any difference when I was drinking the tea. See how I use the tea is just kind of like threw it in there, supplemental. It didn't hurt them. But if you look, I don't make as many promises on the tea. I say supports healthy cardiovascular system, helps manage high blood pressure. I don't say it brings it down. Now, I do have people, they're very sensitive. They don't have mild hypertension. And they say, yeah, I drink the tea, a couple cups a day. It brings me down about 10, 12 points. I'm good. Thank you. So if you just have a little mild diabetes, mild hypertension, you can get away with the tea in the early stages. But unfortunately, nobody comes to me in the early stage. They always do the try everything first method, and usually for years. That's why if you see when I send out this link to this podcast, I say, keep learning, stop Googling. Because people are wasting a tremendous amount of time. We're talking years Googling, buying things online in capsule, buying tinctures with a lot of promises, a lot of hype, buying a bunch of vitamin supplements, which are sometimes just got fancy labels and the same old synthetic vitamins you would get in the supermarket, but they put them in a nice label, fancy label, good marketing, and people buy it. Then they're doing random things, just buying mushrooms because they're meant to be a cure-all nowadays. It's a big fad. And then they do this for years. We're not talking months, years. Sometimes 7 years, 8 years, 10 years, but usually the average is around 2 years, 2 to 3 years. People will try to look online. See, they've already decided they don't want to take that beta blocker or that serotonin uptake inhibitor. Because as you can see just from the names of medications, they're all doing negative things. They're blocking something, they're inhibiting something. And we know that's just going to create a cascade of health problems and side effects. And a lot of people, they will go take the medicine at first. So that's usually the main path. They take the meds because, that white coat kind of convinces them. I never wear a white coat, but I like a little color personally. But anyway, that white coat seems to convince them, the degree, something, I don't know, just like hypnotizes them. And these people who had never taken medication in their life end up doing it. Then after a couple of years, they concerned about the side effects, or they're getting the side effects. And then they start looking online, they trying everything. This goes on for years. And then when they call me, they really are kind of giving up. I mean, they really are convinced herbs don't work. A lot of my clients are convinced herbs don't work. But I ask them, what herbs did you take? Oh, it was a tincture. Oh, you took some capsules. Let me look at that. Oh, that wasn't even mostly herbs. That was a bunch of synthetic vitamins with small amount of herbs. You were even people like ashwagandha. They said, I tried ashwagandha. It didn't work. Oh, what were you taking? Oh, I took one capsule every day. No, it's not going to work. You take a tablespoon, and ashwagandha should be taken in milk. So, it's sometimes it's the carrier that is very important. Ashwagandha is a building, strengthening, warming herb. So you don't take it if you're overweight. You don't take it if you're hot. You don't even take it there's many counterindications for ashwagandha. So most of the time people taking it shouldn't even be taken in the first place. It's probably not hurting them because they're taking such a small amount. But I said you could finish it off if you want, but it's not good. It's not. I have hundreds of herbs to pick from, and that one would be not one that I give you. Another big problem of taking these things in capsules is you're not tasting them. I see this with uh, oregano oil. People are coming to me with heartburn, acidity. Then I look at their form and I see they've been taking oregano oil or moringa in capsule form. And that turns out to be the cause of their heartburn. See, they took these oregano oil in the morning, but they didn't get the heartburn until the evening. So they didn't connect the dots. But that's why capsules are not good too, because you're not tasting the herbs. You should taste the herbs. But back to these powders, this is the main method I use for treating all these health conditions is the Ayurvedic powders. They're the most potent. You're ingesting them. And again, sometimes these powders have to be in carriers. So if you read the label or you do an appointment with me, I say, if you're pitta, you're hot, you're burning, I may say, take that formula in coconut water. If you're overweight, I may say, okay, take it in pomegranate juice or take it with a little honey. And if you're very depleted and underweight and it's an adrenal tonic, which uses a lot of ashwagandha, I may say take it in milk, warm milk or cow milk, because we're trying to build and strengthen muscles and tissue. We don't want it just in water. So the carrier, what the herb goes in, is very important. And that's very important in Ayurveda. Again, it gets too complicated for most of my patients. But if you look at the labels, they will say best in. A lot of times I'm giving colon herbs for people with inflammation, best in with some aloe vera, best with some pomegranate juice, best with some honey. And these are all just going to make it more effective. And of course, this is traditional Ayurveda I'm going by. It just gets so detailed and so sophisticated and so complicated. You have to kind of like simplify it down for people. But again, the powders are the most effective. Now, once you put those powders in capsules, which we don't really like to do, but we do it. Now, we have one here. It's called Biofilm Destroyer, and this is used for mold. And originally, we had the formula just in powder, and it was so bad tasting, kind of like our parasite tea. We just now do the parasite tea. We also do it in capsules because the taste is so bad. This Biofilm Destroyer we use for like herpes and even H. pylori and of course mold, because they have this protective coating, this biofilm protective coating. And we use an herb called Lajalute. And Lajalute really isn't that bad tasting, but it's very slimy. So you put it in a cup, you add a hot water, it becomes like somebody spit some snot in your tea. So this really turned off people. So we put it in capsule for the people. But you got to take a lot more when it's in capsule. Like we sell some other herbs in capsule. Sometimes people say, oh, I can't take it in powder. It tastes too bad. So we say, okay, we give it to you in capsule, say a sleeping formula. So I told you to take 1 teaspoon of this formula. You say, yeah, it works, but tastes bad. So, okay, you pay a little extra money. We put it in capsule for you because we're making all these here. So we have to put it in capsule for you. So there's a little charge for that. People say, I don't care. I don't want to taste it. So I say 3 or 4 capsules equals 1 teaspoon, but they said they're taking 3 or 4 capsules and they're not getting the same results as they did when they took the powder. Well, that's right. You're going to have to take a lot more. Some people told me it's almost double, like 5 or 6 capsules to get the same effect. And that's because you're not really following the basic rule of using an herb. you got to dissolve it into some hot water so you can take it, or some carrier. That's why we're always adding hot water to the powders, boiling decoctions, adding hot water to teas for infusion and letting them sit long enough so the herbs can come out in the water. And then we're drinking the water. Now, when you do the powder, you end up drinking a lot of the powder too, which is why it's so powerful, is because you're ingesting the herbs as well. And they end up being digested and broken down into your system. So a lot less wastage when you're doing powders, because there's no herb being thrown out. Like you do tinctures, we're throwing all the herb out and we only have the extract left. And when you make a tea, you're throwing most of the herb out. Your decoction, sure, you're decocting it and cooking it and boiling it and really getting most out of these roots and barks, and seeds. But still, at the end of the day, you're throwing a big chunk of the herb right in the compost. But not with a powder. You're throwing it in the hot water. It's going into the hot water. You're taking the water down with the herb in it, plus the ground up herb. So 10 times more effective, 10 times more powerful. But when you put it in a capsule, you're just dropping it in your stomach acids, mixing it with food, and you didn't have that chance to, infuse the properties of the herb into the water first. So that's another problem people have. They're just taking capsules. And I find when I give capsules to people, even though I tell them take 3 or 4, something in their head, they think it's like Medicaid. They just take one. They go, oh, the sleeping herb wasn't working. I go, what do you mean that sleeping formula doesn't work? I mean, that thing is a knockout formula. I mean, it's got poppy seed in it, valerian root, hops. I mean, people mostly complain about feeling groggy in the morning. I go, how much were you taking? Well, I couldn't like the taste, so I put it in capsule. Okay. How many capsules did you take? 1. No. If you want to put it in capsules, go take 6. And they're going, oh my God, 6. Well, I tell you, you need at least a spoon, and that's 3 or 4. Now it's in capsules. You're going to have to take more than 3 or 4 to get the same effect. So I know people who were taking, say, an anti-inflammatory formula for their pain, and they go, oh, no, I need it in capsules. Okay, we gave it to them in capsules. And then they said, at the end, they said, no, I was opening the capsules up and just putting them in hot water and drinking it was working so much better. And I was worried I was running out because I was having to take like 10 capsules a day, 10, 15 capsules a day to get my inflammation down. But when I just opened them up and put them in hot water, I only needed like a teaspoon in the morning, a teaspoon in the evening. That's right, because capsules are ineffective. There's no Chinese medicine, Ayurveda medicine. There's no capsules. Now, there are certain herbs that are so powerful and so strong that they come in not capsules, but they're little tabs. Like this is for antifungal. So this is a very bitter, strong formula. It's got a lot of neem in it, and it's for fungal infections, yeast overgrowth, candida, and, any type of, it's almost like an antibiotic. So you don't really want to be taking a teaspoon of this formula. It's just too strong. So they put it in these little tablets just so you can take small doses. You only need a couple of these in the day. It's quite strong. So there's other little ones we sell like that too. These are on my desk here. See, they're just little tabs. They're not capsules. We call them tabs. And this is a kind of a very special formula. We use it. It's an immune modulator. We call it restorative tabs. See, and sulfur tabs. So we have these tabs, but they're purposely in Ayurveda. There's basically the herbs rolled up into little balls. And they did it that way because they wanted to give the dose out small. So when you see the little tiny tabs in Ayurveda, it's probably a very strong formula. So they don't want you taking spoons. They just want you taking little tab. But capsules, putting powders in capsules, not really recommended. And a lot of my clients who did it in capsules said, yeah, after a while, I got used to the taste and I can't afford to be taking all these capsules. It's costing me more, not working as well. And I can feel the effects right away when I take it in powder. For like anxiety or panic attacks, I had people who had the herbs in powder. They complained about the taste because all these herbs don't taste good. You really have to get over that in your head. I mean, if you have diabetes, you've been having sweets your whole life, you're not going to get a sweet herb. It's all going to be bitter at that point. Is these bitter herbs, the old saying, take your bitter medicine. So you got to get over the taste factor. I mean, and if you have children, start giving them herbs young so they get used to the taste, because it's not going to kill you. It's not cutting your tongue. It just tastes bad. The taste goes right away. So, if you're a child, you have children, then you can just mix it with a little fruit juice or something like that and take it. So, herbs do come in other forms as well, like oils. Like here we have a neuropathy oil. There we go. See if it's that neuropathy oil. The light's just so bright. Well, it's very thick. See, it's in coconut oil. Now, the herbs are in the oil, in the coconut oil, because neuropathy creates burning. So you can't use a warm oil like sesame oil. No, you need a cooling oil like coconut oil. And then they put other herbs in there like Brahmi, Shanpushmi, Vacha, that are for the nervous system. So the herbs are in the oils. You put that on your burning feet and you get pretty fast relief. And it starts supporting the nervous system. It starts getting down the burning. So sometimes you're not going to get down that burning neuropathy on the bottom of your feet with any tea or any powder. I can manage your blood sugar with a powder. I can manage your blood sugar even with a strong tea. And we do have blood sugar tea. We have many different blood sugar formulas, insulin dependent formula. But that burning on the feet, you need an oil. Same for hair. You need an oil. The herbs are in the oil, hair oil. So, I mean, I have a formula for hair growth. I think I even have a tea called hair tea, which is weaker, But if somebody's coming to me and, losing hair is their top priority, the oil is going to be the best way, right on the issue. Massage it into the scalp. Then you could give them the formula, throw in the tea for the heck of it. But if somebody's just worried about you're young and you're just worried about losing hair, then you could just drink the tea and use it as more preventive. The teas are very good for preventive. Like I have people with high blood pressure and they take the herbs for 4 or 5 months. It clears their arteries, brings down the inflammation, helps improve the circulation. Their blood pressure is down. They're off their meds. They're all happy. And then I just say, keep drinking the heart tea because that's going to be preventive at this point. So I'll use the strong powders to do the heavy lifting and the work that I need to be done, cleaning out the organ, supporting the nerves, whatever, with the powders, the churnas. And then I'll use the teas either supportive or after I'm done to just keep preventing the condition from coming back. So oils are very effective. And there's hundreds of oils in Ayurveda, particularly for skin problems, eczema, psoriasis. They've got all these oils, fungal infections. People are trying all these crazy things with essential oils, but Ayurveda already has this sorted out hundreds of years ago. They have hundreds of different oils for different type of skin problems and nerve problems. It takes a long time to learn them. I studied mostly in northern India. In northern India, they just mostly use churnas and basmas. We won't go into what those are, but those are their main two forms. But when you get to southern India, where I now stay and have my own place and an office because the weather's better. I mean, southern India, Kerala, it's like California. It's just great weather. You're on the beach. But that's where the source of Ayurveda is, and they use a lot more oils in the south. Oils and ghees. So I've been studying them over the years, probably 7 or 8 years. I've been studying southern India herbal formulas. So I'm probably using about 20 different oils in my practice. But in fact, there's like at least 100. These are traditional oils and they're made by different companies. Even there's different hair oils. So I know the different ones and you just really have to get used to them and study them. So the other form of herbs, which is also southern India, is the grittas or ghees. Now, these we give for people who are dry, depleted, vata types, and particularly when we're trying to build and strengthen and gain weight. In fact, this is a Vidari, Adi, Gritta. Vidari is the main herb. Adi means it's got some other herbs to it, and Gritta means ghee. We just renamed it and called it weight gain ghee. So see, the herbs are in the ghee. So this is for a person, we're trying to gain weight. We don't want these dry powders. And also when you have, let's say I'm trying to treat somebody's liver, their bilirubin, their AST numbers are high. And we're trying to treat the liver, but they're very sensitive. They're very dry skin. Maybe they're vata. not kapha, because we don't generally use these ghees for kapha types. And then we would give liver ghee, detoxes blood, improves dry skin conditions, helps with many arthritic symptoms. And the herbs are in the ghee. These are very difficult to make. I have made them, but we just prefer to import them. And one more form is called rishtas, and we call them elixirs, but basically it's fermented. So the herbs are in like a kind of wine. It has a couple percent of alcohol in them. Now these have big advantages, and there's because they get into the system quickly. They're warming and heating. So somebody like me with a pitta prakriti who's warm and hot, I never use rishtas. They're too hot. They're too heating. But if you're like kapha, like overweight person, big heavy person, we give you what Pipali rishta. Pipali is like the Indian sweet pepper. So it's like pepper and usually some other hot, spicy herbs, in this kind of like, you call it like a wine. We call it elixir because we can't use the word wine. And it only has a little alcohol. Now you sip that before your and after your meals. That really improves your digestion. But if you're anybody who's have heartburn or acidity, then you wouldn't use these rishtas or fermented herbs. Now, these are also very common in the South. The South, they like to use ghees, rishtas, and oils more than the Northern India. Northern India may just tell you to mix it with something. So those are the main forms we have. Oh, one more, and it's like a jam. Now, a jam, there's the most famous, we call it this 7-tissue building jam. And you can see it. It looks like ghee, but it has honey in it and ghee, usually honey and ghee together. We just call it ghee. The most famous one is Chawan Prash. Chawan Prash. Prash means jam. These are like a prash. There's also rasianas, which are building, but they have usually honey and ghee, and the herbs are cooked in there. Chawan Prash is a very famous formula for immunity and depletion. Chawan was the name of the guy who made it. He was an old man, apparently, and he lived long, and he made his formula. And prash means like jam. So he got the herbs mixed with ghee, mixed with honey, and sometimes some juice of some plants like the amlaki, and then a lot of herbs. He's like cooking it all together, and he's making this jam. And then you take a spoon of it every day. Very good for children. And a lot of times they're sweet. They even have a honey or even cane sugar into them. So they're very easy to take. They're very nutritious. There's more other benefits in them. They're prashes. So that's why they call it Chawan Prash. And it means the guy Chawan is prash, his jam, his famous jam. And he was 600-700 years ago. And we're still taking his formula today. You can buy Chawan Prash on Amazon. And that was made 600 years ago. So there's hundreds of these in Ayurveda. This is one prash. So I hope that gave you an idea of the wide scope of different forms of herbs and how to take herbs. So a few more things, since I really want to focus on this question of how to take the herbs. If you go to see Ayurveda doctor, you're always going to get an herb to take after the meal, because in Ayurveda, digestion is paramount. So it doesn't matter what condition you come with, arthritis, joint pain, diabetes, high blood pressure, cholesterol, IBS, you're going to get an herb after the meal, because that is usually the key herb. And there's usually herbs in there that are doing other things besides lowering your inflammation, or lowering your blood pressure or managing your blood sugar. There's usually herbs in there for digestion as well. So you may have a heart tonic, or you may have some product that's, lowering inflammation in the body or joint pain, and there's also herbs in there for digestion. So the herbalist, he knows this formula is made to take after meals. So timing is also very important. And that's usually the main herbal product that you get from an Ayurvedic doctor, is the one after the meal. So that's the one you should skip. The teas, many of these are Western teas. They're like secondary, supplemental. Tincture would be secondary, supplemental. The main herb will be after meals. The second category, most common, is morning and evening. So you have high blood pressure. You look the high blood pressure herbs. They don't have digestive herbs in them, like the blood sugar herbs. There's some herbs to bring your blood sugar down. There's herbs to help you digest the food, all mixed together, and you take it after the meal. But for, say, blood pressure, you take 1 teaspoon in the morning, 1 teaspoon in the evening. A lot of herbs are like that, morning and evening. And then there's some that you just take at night, to sleep, to have bowel movements the next day. And sometimes there's other reasons the Ayurveda doctor wants to give you some herbs at night. So most of my patients, no matter what you come to, you're going to have something after, some powder after their meal, something morning and evening. It could be for anxiety, it could be for inflammation, it could be for high blood pressure. So you're taking it morning and evening, and you're taking some after a meal. And then at night, before you go to bed, you're going to take something else, maybe for the colon or to sleep or something like that. So there'll be 3 products you're always going to get from a good herbalist. After meals, morning and evening, or sometimes just morning. If it's for the nerves, like anxiety, you can just take it in the morning, and then something in the evening. Then on top of that, because I'm a Western herbalist and Ayurvedic herbalist, I may throw in a couple teas. I may throw in, okay, here's a heart tea, drink a couple cups in the day. Here's a relaxing tea, drink that in the evening before you have your sleeping formula. So I'm just kind of putting the teas on top to kind of support the treatments that I'm doing. In that case, I could have been treating digestion, inflammation with the meal, the herb after meal. The morning and evening, I could be treating the blood pressure. And at night, I could be treating the colon or the sleep. So I'm at 3 or 4. There's 4 treatments taking place. So then I may have a couple teas to kind of back it up, like the heart tea or relaxing tea. But if you don't do those teas, it's not that important to the Ayurvedic doctor. So unfortunately, a lot of my clients say, "Oh, hey, I love the teas. I'm taking the teas, but the powders didn't taste good, so I'm not taking them." I go, no, it's the opposite. If you don't have time for the teas, fine. Take the powders, and particularly the one after meals. That's the most important one. And remember, if it's not working, you just take more, not less, and don't stop it. And if you take something and you feel it's too strong, making you feel nauseated or making you too groggy or giving you loose stools, you don't stop it. You just reduce it down. That's another very important point on how to take herbal medicine. You have to keep going. You have to take it for a while. It's always a few months. And sometimes it's up to a year if you've got multiple big health issues that need to be reversed, like kidney failure. It can take a year of taking herbs to reverse the kidney failure. You can't just go for a month or 2 and stop. You missed it. So very important you continue. And 2, is that increase and decrease the dosage as needed. If you're not, getting your blood pressure down, your blood sugar down, or getting yourself to sleep, or your bowels moving, you just take more. Simple. And if you feel it's too strong, or now your bowels are moving fine, your blood pressure's already down, it's not that high anymore, your blood sugar is staying more stable, then you can reduce it down. I wouldn't stop it unless, I say to stop it. But just reduce it down. Just take less and keep going. Because just because the numbers got good doesn't mean that the herbs have finished their job doing what they need to do to your systems and organs, like helping improve the pancreas function, insulin resistance, the circulatory system, the cardiovascular system. They're going to improve that, supporting the nervous system, bringing down inflammation in the whole body or inflammation in the colon. They're working like a team, working on this objective of, say, bringing inflammation down in the bladder so you're not urinating at night, or improving the function of the kidneys so you don't have to go to dialysis. It's going to take time. So you have to keep going. And if you miss a few times, that's fine. You could just keep going the next day. You don't stop suddenly. You just slowly reduce down and keep an eye on the condition. And eventually you wouldn't need to take the herbs. But again, you may want to just, if you've had like prostate problems, you may want to just keep drinking the prostate tea. So C4, I have a tea for prostate and a powder. Now, if you just have inflamed prostate, I can give you the tea because it's going to bring down the inflammation and get the flow going, so reduce your urination at night. But if you've got an enlarged prostate, well, the tea isn't going to shrink it down. I have to use the powders to break down that tissue because they're more strong and to shrink the size of it. It's the same for a tumor. If you're just worried about maybe cancer spreading and maybe after surgery, or you had the tumor removed, so there's no more tumor, but you just don't want it to come back, then these teas could be keep your immunity high and fight cancer cells and prevent it. But once you have the tumor, you got to do the powders, the terrible tasting strong powders to break down that tumor and reduce it down. So whenever there's anything strong, heavy lifting to do, you need the powders. Okay. Well, I hope that answered a lot of your questions there, folks. And I hope that this helped you have a better understanding of how to take herbs, what herbs are about, and have more faith and more confidence, and don't just give up just because you've had a few tinctures or a few capsules of some herb that you bought, or something you picked off of Instagram, and now you don't think herbs are working at all. So anyway, I wish everybody the best of health and happiness. God bless you all. And I hope that you have more confidence and faith in herbs. And remember, the most important thing about herbs is who prepared them for you, who gave them to you. That's why, Instagram healthcare is never a good idea. You don't even know who's posting this stuff. You just can't randomly be trying herbs unless you know these things. That's why people are foolishly taking 5 or 6 types of mushrooms together and thinking it's some type of cure-all. I mean, if a 70-year-old Chinese doctor gave you mushrooms, take it. If somebody on Instagram told you to take mushrooms, don't take it. It's who prescribed it, his skill and his knowledge. And you're not going to have that knowledge until you're at least 40 years old. Better, your herbalist is 50, 60, 70 years old. Older, the better, because it just takes experience to understand hundreds, if not thousands of herbs and how to mix them up. And he needs the experience of treating people and getting the feedback so he can pick the right doses, make the right formula, and really know what these herbs are doing. Unfortunately, most people, they just make herbs by formulas on their own, the ones we see for sale online. They're just searching online, hey, what herbs are good for high blood pressure? There's no training. There's no understanding of the individual herbs. It's a kind of it should work approach. So you need to avoid that. Find a good herbalist, nice old guy who's been doing it his whole life. And there are people online with those qualifications. They're just hard to find because they usually have their own private practice. But once again, I recommend you go see herbmanteas.com. Our sponsor has 50 teas, 1 tea for every health condition. And they are starting to put up more of these formulas and powders. So I would always explore that first, particularly if your condition is in the early stage. Go visit our sponsor, Herb Man Teas, and look at that selection and and read carefully what is said about each formula to make sure it's suitable for you. Once again, folks, God bless you all, and I wish you the best of health and happiness.